2 Pfizer shipments arrived early Monday morning in Utah at 2 Intermountain hospitals. Each one of these boxes holds 975 COVID-19 vaccinations, a little less than 2,000 doses.
2 of our facilities we know have received vaccine at this time, Utah Valley and the LDS Hospital, and we anticipate that several of our other facilities should receive it either tomorrow or by the end of the week.
As ICUs across Utah continue to experience high numbers of those suffering from impacts of COVID-19, healthcare workers on the front line are said to be anxious to receive vaccines, hoping to keep them safe from the virus. Appointments will be set up by email, allowing those who want them to be vaccinated first.
These would include those who work on our COVID units, our ICU care doctors, nurses, technicians, those who work on medical units, those who work on our environmental services and deal with COVID-related waste, those who are in respiratory therapy who help others breathe more safely when they are sick.
We now have a new and effective tool to combat this pandemic. In addition to the public health measures which we know that work, social distancing, wearing a mask, washing our hands, in addition to the new medications that we have developed in the past 9 months, remdesivir, steroids, monoclonal antibodies, we now have a vaccine to prevent this infection from becoming worse. This is a proud day for science, and it's a proud day for medicine.
The Pfizer COVID-19 vaccine is the first of a 2-series shot healthcare workers will receive, the second dose being in 21 days. Because this vaccine is stored at minus 80 degrees, it must be thawed for about 2 to 3 hours before it can be administered. The vaccine must then be given within 6 hours.
Once it is then put into a diluent, a fluid to be administered, it will be placed into syringes that are pre-measured so that there's no risk of unintended dosages at the bedside. So they'll be in pre-filled syringes. They will then be needed to be administered within 6 hours to ensure stability, and will be administered in one of our facilities immediately.
While studies on this vaccine over the past 2 months have shown it to be 95% effective, there could be some side effects by some who take it.
We'll do our best to keep our caregivers scheduled in a way that's at the end of their shift week. So if they're finishing up their week of work, we get it to them on that last day so that potentially they would have adverse events while they're at home and can recuperate and come back to work safely. However, for those that do want to come back to work, we will likely perform testing to ensure that they can safely come back to work with an antigen test. That, of course, as per CDC guidance, presumes that they only have adverse events that are associated with the vaccine, such as fevers, body aches, and headaches.
While the shot isn't mandatory, most healthcare workers are looking forward to receiving the vaccine. And as more shipments of the vaccines are approved by the FDA and become available, those who are 65 and older or with higher comorbidities will be next to receive the vaccines, which could be as early as January to March. Vaccines are expected to be available to the general public by this spring and summer months. And even as these vaccines roll out, healthcare providers remind us that until a majority of the public is vaccinated and the virus is under control, masks and social distancing will still be needed.
Even if you're vaccinated, you may still be able to transmit virus to those that are at high risk for negative outcomes if infected. So it's going to be very, very critical that we all maintain these great public health practices that we've been doing.
Dixie Regional Medical Center should receive their vaccines by the end of this week. In St. George, Melissa Anderson, Community Education News.